Homeopathy can work wonders in bruises, injuries, and sprains. A bruise is one of the most common types of injury. It occurs when there is a blow or a fall which causes small blood vessels to break under the skin. This leads to discoloration and swelling, which is caused by blood seeping into the tissue. We'll be taking a look at 11 remedies which can help. As we mentioned earlier, bruising is always accompanied with discoloration and swelling. There will also be an accompanying pain. What starts as a red discoloration and swelling shortly turns into blue, green, then yellow, and finally fades away as the healing process takes place. A cold compress is best after injury, and a moist hot compress works best after 24 hours because it improves circulation. Anytime there is an injury and there is bruising, the first remedy of choice is arnica. Immediately give arnica. If arnica, however, does not help, then try to see the location and find out where. In case it is injury or bruising to the soft tissues, such as the breast, then the remedy of choice is bellis perennis. If there is a poke injury to the eye, then the choice is ledum. In case there is injury to the tendons, then ruta will be your choice. If it is bruising to place or places where there is a varicose vein, in that case the choice is hemimelis. If it's a blunt injury to the eye, not a poke injury which we talked about a while ago where we chose ledum, a blunt injury to the eye such as a black eye, if somebody has been injured in the face, that will require symphytum. And finally, if there is nerve pain or if there is injury or bruising to areas which are rich with nerves such as fingertips, in that case the choice of a remedy will be hypericum. If somebody has crushed the fingertips while closing a car door, in that case your choice will be hypericum. So in this one single slide we have covered 7 remedies, and these could really help you in most situations. Homeopathy can work wonders in sports injuries. As a first aid, immediately give arnica for all kinds of trauma. In case the trauma is accompanied with severe shock, then aconite should also be considered. For cuts and grazes that happen during sports injuries, we have a separate lesson for that, titled Wounds. In case of sprains, see the next slide. In case of sprains, you can follow this decision-making chart and the next to determine the remedies. First of all, in case of a sprain, find out if the person also complains of stiffness. If that is the case, then Rustox is the remedy. If it is not, then check out if there is any kind of a tearing pain complaint. If indeed it is there, then Ruta is the remedy of choice for what is described as tearing pain. If there is no tearing pain, then please check whether the place or part is swollen and it hurts to move. If it does, then it points to bryonia. If it does not, we shall see it in the next chart. Continuing from where we left off in the last slide, which was swollen and hurts to move. If that is not the case, it could be very swollen and the person jumps at the slightest touch, very sensitive to touch. If that is the case, then apis is the remedy. If it does not, then just check out, is there much bruising? If indeed it is there, is it from overdoing something, exerting yourself over and above the effort that is required? if that is the case, it points to arnica. For example, overdoing could mean ending up in this condition by doing excessive sport, for example, weightlifting or gymnastics. Overdoing anything results in a condition which requires arnica. As a matter of fact, it could also be mental, not just physical. If it is not from overdoing anything, then Bellis perennis, which we saw earlier, can be of use. Just follow the lines of the chart to make sure you're making the right choice. If it is not with much bruising, then a good remedy is a gel which has been prepared with mother tinctures of rustox and ruta. Very often this is available from a pharmacy which sells homeopathic products. Let us now take a look at the modalities and the generalities. Modalities are those conditions which make a person feel better or worse, and generalities are those characteristics which are common to other parts or regions of the body, not specifically to the place where there is a complaint. Aconite is best indicated when there is shock following an injury. Aconite feels better in open air and feels worse in a warm room. And the other concomitants are that there is anxiety and fear in the mind of the person. It could be accompanied with vomiting and a dry mouth. Apis feels better with cold application and uncovering the skin where bruising or injury has occurred. It is worse application of heat and it does not desire to be touched. There could be swelling in the extremities, and also it is very useful in cases of synovitis. Synovial membrane is that which lubricates the joints during movement. Arnica feels better lying down. It is worse movement and does not desire to be touched at all. It is very sensitive to being touched. Arnica is also very well indicated in cases of physical or mental exertion, overdoing anything, and it is the best remedy during a traumatic injury. Bellis feels better with movement and motion, and it likes local cold application. It is worse warmth and application of heat, and it is better indicated if the injury or bruising is left-sided predominantly. Also, it is particularly indicated in cases of injury or bruising to soft tissue such as the breast, and it is also particularly does well in sprains and boils. Bryonia alba feels better after resting. It is worse with movement or motion, and the person can be irritable and also thirsty. Hamamelis feels better with rest, and it is worse in damp or warm, moist air. Also, to remember is that the person can complain that the entire body feels bruised, and the tincture can be used if the skin is broken. Entire body feeling bruised is also common to arnica, where the person can say it feels as if he has been beaten. But arnica generally we do not use in the tincture form if the skin is broken. Hypericum, as we saw earlier, is for bruises that affect the nerves. It's also very useful in neuritis after bruising. People requiring hypericum are particularly better by rubbing the affected part or by simply lying quietly. They are worse in the cold. It is particularly useful in any kind of crush injury, particularly to the digits, that means the toes or fingers. Ledum feels better in the cold or with cold application. Another peculiar characteristic is that if the person hangs the affected part, it feels better. The person feels worse in warmth, and the bruising can last for quite some time. Rust ox feels better in open air and also by uncovering the skin. It feels worse in cold, and it is worst in the initial movement. So a person can complain that he feels better once he starts moving around. Also, by lying on the bruised part, the person feels worse. The skin can often be red and it can have swelling and itching. In fact, rust ox is a big remedy as far as skin complaints are concerned, and we shall be looking at that in another lesson. Now we will look at the 10th remedy of this lesson, which is Ruta. Ruta feels better in warmth, and a gentle rubbing or even scratching the affected part feels better. It is worse lying down, and of course cold does not help because warmth feels better. It has an affinity for the injury to the bone and periosteum, and it is also very useful in muscular sprains. It's a very good sprain remedy. Symphytum is a remedy that is associated with the growth of bone. So it is an excellent remedy in case of fractures. But we shall be dealing with that in another lesson. For the moment, symphytum feels better with warmth and changing the position. Any change in position improves. They feel worse at night and are averse to touch. It is, as I said earlier, an excellent remedy for bone injury, and it's the best remedy for any eye injury. That's almost a specific. For example, a black eye will also respond very well to symphytum, as will ledum. If you are treating someone or yourself, please remember these are the red flags, red lines you should never cross. If you find there is no improvement after a week or so, or if there is an unusually large and unprovoked bruising which you can't explain with any injury. Also, if it keeps occurring or comes back again and again. And finally, if it is located on a part where injury is unlikely. There are deeper reasons and you must seek medical opinion. So in this lesson, we considered 11 remedies for bruises and injuries, and now we shall just go through a quick review. So let's take a look at the 11 remedies that we saw in this lesson for bruises and injury. The first one we considered was aconite, which is characterized by suddenness and shock. We looked at apis, which is usually accompanied with swellings which are pink in color. Arnica, of course, is the remedy of choice at the first instance in case of any kind of injury. Bellis perennis was used when we had injury to the soft tissue, especially to the breast. Then we took a look at bryonia, and we also saw its usage and application for the synovial membrane. Then we had hamamelis, which refers to pain and injury in the case of varicose veins. Hypericum is of tremendous help when there is injury to areas which are rich in nerves, such as fingertips. Then we looked at ledum, which is characterized by bruises with dark purple ecchymosis. Then we had a look at rust ox, and the characteristic of rust ox is that the initial movement after being at rest for a long time feels painful. We also took a look at ruta, which is for bruises to the bone and periosteum, and finally symphytum, in which case there is also a blow injury and it involves bones and the periosteum, that means the surfaces of bones. So friends, thank you very much for your attention. This brings us to the end of the lesson on bruises and injuries, and we shall meet once again in another lesson. Until then, bye bye and thank you.